Welcome to the topic, local and general anesthesia. What is anesthesia? So anesthesia is a reversible process that produces a local or general loss of sensation, including the pain. How many types of anesthesia? They can be general, regional. Regional can be spinal, epidural, or peripheral nerve block. And then we have a local anesthesia. What are the methods of this local and regional anesthesias to be done? If it's an epidural anesthesia, we inject into the epidural space of the spinal cord, and it is most commonly used in the obstetrics during the labor and delivery. Infiltration anesthesia, which is field block, it is directly injected into the tissue immediate to the surgical site. And the drug diffuses into the tissue to block a specific group of the nerves in a small area, very close to the area to be operated on. Then we have nerve block anesthesia. The method is the direct injection into the tissue that may be distant from the operation site. And this drug affects the bundle of nerves serving the area to be operated on, used to block sensation in a limb or the large area of the face. Then we have spinal anesthesia. We inject into the, as the name is the spinal, we inject in CS, cerebrospinal fluid. Drug affects the large regional area, such as the lower abdomen and the legs. Then we have topical or surface anesthesia. We use by creams, sprays, suppositories, drops, and lozenges. They are applied to the mucous membranes, including the eyes, lips, gums, nasal membranes, and throat, and it is very safe and unless absorbed. So these are all the routes of the local and the regional anesthesia. What are their methods, how to give them, and what do they do, which part is affected by which anesthesia. First, we'll talk about the local anesthesia. It causes the rapid loss of sensation, but only to a limited part of the body, not into the total body. That is why it is called as local. So it has a local effect only. Types of local anesthesia. It's showing us the local can be topical, like just on the body. Number 2, it can be infiltration. We can filter them. Number 3, we can also block the nerves with the local anesthesia. And then we can do some spinals, and we can also do some and the epidural. So local anesthesia can be of these different types. Now they produce their therapeutic effect by blocking the entry of sodium ions into the neurons. What does that mean? It means, like in this picture, we are seeing here, these are the sodium channels. They are coming in, they're coming in. So what happens? These things, they're called as the sodium channel blockers. So what happened in a normal nerve conduction, the sodium ions, they always enter the sodium channels along the neuron and allow the neuron to fire or set off an action potential and conduct an impulse. So usually they go in, but the local anesthetics represented by these red X's, they block the sodium channels. So if the sodium channels are blocked, the sodium will not go in. If the sodium will not go in, then there will be no action potential can be conducted along the nerve. And for the time this is blocked, sodium is not going in, action potential is not there. So person will become, that part will become unconscious, that part will become not active. Now local anesthetics, they are classified by their chemical structure. It looks like this. It has a benzene ring in, it has a nitrogen, hydrogen, oxygen ring in, oxygens in them. Now, what are the classes of the local anesthesia? They refer to the chemical linkages. So if it's chemically, we can say them, the local anesthetics can be esters. They can be cocaine, natural esters. First, local anesthetics. For example, benzocaine as well, which is used as topically for sunburn, for insect bites, for minor wounds. Then we have another class, which is called as amides, and they are replaced esters with fewer side effects. And the lidocaine is one of the most widely used examples of the local anesthetics. So benzocaine and lidocaine. These are the two local anesthetics, and they're available outside as an OTC also. This is the general formula for the ester. They are telling you ester includes also procaine. Amide includes the lidocaine. Then we talk about general anesthesia. So general is the name general. So it's completely getting the loss of sensation through the entire body and accompanied by the loss of the consciousness. So the person is in sleep. So general anesthesia's goal is to provide a rapid and a complete loss of sensation. And the signs includes that there will be no feeling of the pain, that is total analgesia, loss of consciousness, loss of memory as well, and the body movement. So you can't move, you don't remember what happened in the time when you were unconscious, and no feeling of pain at the time of when you are unconscious. There is one, we give the patients the balanced anesthesia. To make an anesthesia in a balanced amount, we have to use the multiple medications. It's not with one. It rapidly causes unconsciousness and also gives you the muscle relaxation for that time. It maintains the deep anesthesia. If a person has to go in surgery, then they will provide that deep anesthesia for that time. And it allows the dose of inhalation anesthetic to be lower than the normal, and the procedure is safe for the patient. That is all about when we have to give a person a balanced anesthesia for the surgeries or surgical procedures. What are the stages of the general anesthesia? Stage 1. When we give the anesthesia, first there will be the loss of pain. The patient generally loses the sensation but may be awake. This stage proceeds until the patient loses consciousness. Then he enters into the stage 2. In stage 2, there happens the excitement and hyperactivity. So the patient may be delirious and try to resist the treatment. Heartbeat and breathing may become irregular at that time and the blood pressure can increase. This is the stage when some IV agents are administered to calm the patient at that time. Then comes to stage 3, that is the surgical anesthesia. Now they can start the surgery. At that time, the body's skeletal muscles, they became relaxed. The delirium stabilizes, cardiovascular and breathing respiratory activities, they stabilizes, and eye movements slow down. The patient becomes very still at that time. We can perform the surgery, and this is the stage for the final surgical things. Then is the stage 4. It causes the paralysis of the medulla region in the brain, responsible for controlling the respiratory and cardiovascular activity. And if breathing or heart stops, death could result. So this stage is usually avoided during the general anesthesia. We only give the anesthesia that can be stage up to stage 3. So general anesthesias are usually administered by the intravenous, IV, or inhalation route. What are the methods of administration? Intravenous agents are administered first and acts within a few seconds. Inhaled agents, they are used after the patient loses consciousness. Then we give them another inhaled agents. We maintain the anesthesia then. So we maintain the anesthesia with inhaled agents, and then it may be used alone and we are not giving the intravenous agents to them. So during the surgical procedures, when lower stages are required, we might be using only the inhaled agents. Now, IV anesthetics, they are important supplements to general anesthesia and include the drugs are barbiturates, we give them opioids, and we give them the benzodiazepines. So if we talk about the IV anesthetics, with inhaled anesthetics first, it allows the dose of inhaled agent to be reduced, and it lessens the possibility of the serious adverse effects, and it provides more analgesia, more pain relieving, and the muscle relaxation than inhaled anesthetic alone. So if we combine IV with inhaled, all these things will happen. If IV anesthetic is given alone, then the medical procedures that takes place less than 15 minutes, only in that cases. For example, barbiturates, opioids, and benzodiazepines, we will be giving these ones if we are giving the alone IV anesthetics. Now, non-anesthetic drugs are used as adjuncts to anesthesia and include the barbiturates, barbiturate-like drugs, opioids, neuromuscular blocking agents, and other miscellaneous drugs. One, we are giving anesthetic, another, we are giving these drugs to the patient so that they show an adjunctive effect with them. Now, what are those non-anesthetic drugs that we are talking about? We give them barbiturates or we give them benzodiazepines, which are pre-operative. So we give them before the surgery. They relieve the anxiety and provide the mild sedation to the person before going to the surgery. We can give the opioids and they will counteract the post-operative pain. Then we also use anticholinergics, which dry the secretions of the body and suppresses the bradycardia caused by some anesthetics as well. We don't want to have the patient throwing out, puking out, so we have to dry the sensation secretions. That is, we give them anticholinergics. We give them neuromuscular blockers so that the total muscle relaxation can occur during the time of surgery. Now, what are the post-operative drugs we use? Again, there will be pain after surgery, so we give them analgesics that reduces pain. We give antiemetics, which is for nausea and vomiting. We give some parasympathomimetics because they stimulate the smooth muscle of the bowel and urinary tract to begin working again following surgery. Because during the time of surgery, we stopped their whole activities of the body and now we want to activate them again. Now, what are the key drugs used in the local and general anesthesia? Benzodiazepine, which is used for induction. They can be diazepam, enflurane, halothane, or nitrous oxide. We use some intravenous anesthetics, which gives a sedative and hypnotic effect. They can be propofol. We have local anesthetics, they're amide type, they're lidocaine. We can use narcotic analgesics, that is fentanyl citrate or duragesic. Neuromuscular blockers is an adjunct, and it also used for paralysis, that is the succinylcholine. Parasympathomimetics is an adjunct again, the drug is bethanycol. Post-operative sedation, the barbiturate, we give them the pentobarbital and the phenobarbital. Topical anesthetics, we give them the benzocaine. So finally, we did in this topic is about the administration of the local anesthetics that results in the rapid loss of sensation by blocking the entry of sodium ions into the neurons. And local anesthetics, they classified according to the chemical structure. General anesthesia, it loss of sensation to the entire body and given IV or inhalation. Then we did IV anesthesia, which supplements the general anesthesia. And we did the non-anesthetic drugs, which are used prior, during, and the post-surgery. So that is all for anesthesia. Thanks for watching.